na na, na 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 na. Yeah, my lover, put your head up on my shoulder. I give you roses and it over. Only you get my.
Welcome back. This is your fave nurse, and today we have one of my greatest friends and one of my best friends named Queenie. Would you like to introduce yourself?
Hi everyone, I'm Queenie and I'm a cardiac sonographer.
Okay, so I bet everyone's wondering, what is a cardiac sonographer?
Yes. A cardiac sonographer do the echocardiograms for the cardiologist. And the echocardiogram is the ultrasound of the heart. As an cardiac sonographer, we check the heart valves to see how well they're open and closed, the heart chambers to see how well they're functioning. We also check for fluid around the heart and vegetations and a lot of different things.
Wow. So what I wanted to make clear too is the fact that so this would be a cardiac workup. So if someone comes in and if they have signs and symptoms that may lead the doctor to think that they might have something going on with their heart, their cardiac function, then that's when they would call my girl Queenie in, and they would do an echo, like she said, like she mentioned, to do the whole workup, to check the valve, the fluid, all of that fun stuff. You want to add something?
Oh yeah,
too?
I was gonna say there's many different reasons why a doctor could ask, put an order for a echocardiogram. It could be chest pain, it could be pulmonary edema, it could be pulmonary hypertension. There's so many different reasons why they could put an order for, for an echo for any patient. And again, of course, patient with already heart failures and patient already have heart issues. So they have to make sure that the function is good.
Yeah. And I know many people are wondering, like, what's the difference between an EKG and an echo? And the biggest thing that they have in common, an EKG can test to see if you're having a cardiac event, an MI, or heart attack right now. Or it can tell you if someone had it previously. But the echo is actually a better tool to see the function of the heart, like how the heart really looks like. And that's why my friend is so important.
Definitely. It's as a cardiac sonographer and working with a cardiologist, they rely on you for a lot of different things. If a patient have a clot or pulmonary embolism, and they usually ask the cardiac sonographer to make sure that the patient doesn't have any clots in the right side of the heart. If a patient just had a heart transplant, that's my job to make sure that the function is after a heart surgery, or sometimes the patient could have a device placed into the heart if they had heart failure, and my job is also to check to make sure that that device is working properly or it's doing the job that it's supposed to be doing.
Wow. You're so important. If someone is interested in becoming a cardiac sonographer, what schooling, education do they have to do in order to become one?
Well, for me, I already had a bachelor's degree in biology. We both went to Fitchburg State University. Yes. And I had already taken all the pre-requirement or the prerequisite for the program. But you don't need a bachelor's degree. All you need is an associate in science. And there's a lot of different classes that are required. Anatomy and physiology being one of them. I believe physics, even though you will take physics again, but it's a different type of physics. There's certain math classes, English classes, pretty much an associate in science where you take certain different type of science classes. I don't really remember all the classes. And there's different programs. My program was a 1-year fast track accelerated program in California that I did at Loma Linda University. But there's also different ones all over the place. They're 2 years, 2 to 3 years, I believe. There's also a program here in Boston that's 4 years. You can get if you already know that's what you want to do, you can do that as a bachelor's degree in cardiac sonography, actually. I personally didn't, but since I already had a bachelor's degree, I didn't want to do 2 to 3 years to get a certificate in cardiac sonography. I mainly looked at schools that had accelerated programs in California, Loma Linda University being one of them.
There you go. There you have it. So if you're interested, just getting an associate's, you can get that, or you can get a bachelor's degree as well, which is 2 years, 4-year program, the difference between that. And based on your experience overall, what would you recommend? Like, what advice would you give to people who are interested in becoming a cardiac sonographer? Do you feel like it's a great stepping stone to the healthcare career, field? Like, what advice would, if you were talking to someone, what if you're talking to yourself 10 years ago or 5 years ago, what would you recommend to someone?
If this was my end goal and I didn't want to do anything else being a cardiac sonographer, I would definitely not recommend a bachelor's degree, because that's a lot of schooling. It's just a lot of money that you're spending that you don't need. You just need an associate, which is 2 years, and then you can apply to the program and spend the other 1 year or 2 years. But also, if you want a bachelor's degree in cardiac sonography, which is pretty much the same, because you would have to do an associate for 2 years and apply to the program. So if you could do it in that amount of time, I think that's great. If you also plan on doing other things, getting the bachelor's degree in cardiac sonography would be amazing, because you will be working as a cardiac sonographer and you'll have your bachelor's degree, and moving forward, you can also use that bachelor's degree to apply to a master program or anything else that you might want to do. Okay,
well, that's some good ideas. That's some great advice, because, you know, especially about the saving money and not going for the 4 years. If you can do something that's, you know, only 2 years and still get the same amount of salary as someone that, you know, has a 4-year, I would recommend doing the 2-year. Right. So, I haven't asked this in a while. What is a starting hourly wage? You can say in Boston, Massachusetts. She's living in Georgia right now, FYI. But in Boston, what would be the starting salary or starting hourly wage?
I'm not 100% sure, but when I was looking into sonography school back in 2017, I had the opportunity to shadow different cardiac sonographers at the Brigham and Women's Hospital, and I was told that the starting salary at that time was $36 an hour. So 3 years from now, 4 years later, I'm assuming it would probably be much higher than back in 2017.
So yeah, so an associate's degree that gets you $36 an hour, I would recommend if you're interested. Yes. But yeah, so one last thing before you leave. Since you are a cardiac sonographer, are there other programs out there? It doesn't necessarily have to be a cardiac sonography.
Well, yes, there's general sonography. I don't do general sonography. My specialty is the heart, so I mainly focus on the heart. But there's also general sonography who does sonogram for the liver, babies. I was also trained to do pediatric, but I'm just not working in that field, and you need a different license. You have to take another board. I'm licensed in adult, and you can also be licensed in pediatric, but I didn't take the board. I decided I didn't want to do pediatric, so I only have my license for adult.
Okay. And then you took a board for the adults.
Yeah, so after the program, actually before the program was done, I had to take 2 boards. One was a physics board. It's called the SPI, which is required to pass. And if you don't pass the SPI, you can't take your adult echo board. So I did that first, pass with the grace of God. It was a very tough exam, yes, but I did it. And then before I graduated, I actually took my adult board exam, and I got my license before I was done with the program.
Well, there you have it, guys. Like I mentioned, it's a great field, great money. Why not if you're interested? There's different areas, like Queenie said. There's cardiac, the general. You can do the peds, liver, all that fun stuff. But thank you for watching, everyone. Thank you for having.
Of course.
Thank you for coming.
Thank you for having me.
I know. I'm so excited to share this all with you guys. Please like and subscribe, guys. And we'll see you later. Bye.